There is something about long periods without intimacy that most doctors never explain to men your age. Today I will. A man walked into my office last month, sat down, and said something I hear more often than you might think. He said, "Doc, it has been 2 years, and honestly, I am not even sure my body remembers how anymore." He was 67, recently widowed, and he had convinced himself that the absence of intimacy for that long had permanently changed something in him, that his body had shut down that part of himself for good. And while I understood his fear, I also knew he was operating on a myth that keeps too many men trapped in unnecessary shame and decline. Because here is what actually happens when you go months or years without sexual activity. Your body does not forget, but it does change. And those changes are not just physical, they are vascular, hormonal, neurological, and psychological. Some of those changes are reversible with the right intervention. Some require deliberate action to undo. And today, I am going to walk you through exactly what happens at each stage, why it matters, and what you can do about it before the changes become permanent. The myth you have been told is this: use it or lose it is just a saying. You have heard that phrase your whole life, usually delivered as a joke or a vague warning without any real science behind it. And because it sounds like folk wisdom, most men dismiss it. But here is the truth that peer-reviewed urology research has confirmed over and over. Regular sexual activity, whether partnered or through self-pleasure, maintains vascular health, preserves nerve sensitivity, supports healthy hormone levels, and prevents structural changes in erectile tissue that lead to permanent dysfunction. When that activity stops for extended periods, your body begins to adapt to the absence. Blood vessels narrow. Smooth muscle tissue in the corpora cavernosa gets replaced with collagen, making erections harder to achieve and maintain. Testosterone production drops, and the psychological loop of avoidance and anxiety becomes self-reinforcing. This is not scare tactics, this is physiology. And the good news is that understanding the timeline and the mechanisms gives you the power to reverse or prevent most of it. My name is Dr. Mariana, and I am a board-certified urologist and men's health specialist with over 14 years of clinical experience working with men navigating the physical and emotional challenges of aging, intimacy, and sexual health. I have sat with thousands of men who thought their declining function was inevitable, irreversible, or too embarrassing to even discuss. And I have walked those same men through evidence-based strategies that restored not just their physical capability, but their confidence, their sense of self, and their willingness to engage with life fully again. Today I'm going to give you the science, the timeline, and the action steps so you understand exactly what is happening in your body and what you can do about it. If you are finding this kind of direct, science-backed men's health content valuable, do me a favor right now and hit that like button. If you have not subscribed yet, go ahead and subscribe because I post videos like this every single week, and I want to hear from you. Drop a comment below and tell me where you are watching from. I love seeing this community of wise, health-forward men and women grow all over the world. Now let us talk about what actually happens inside your body when intimacy stops. First, let us address what happens to your blood vessels. Regular erections, whether from sexual activity, self-pleasure, or even the spontaneous erections that happen during REM sleep, are essential for maintaining endothelial health in the penile arteries. Every time you have an erection, oxygenated blood floods into the erectile tissue. That oxygen nourishes the smooth muscle cells lining the corpora cavernosa and prevents a process called fibrosis, where healthy, elastic tissue gets replaced with stiff collagen. Think of it like a hose that sits unused in the garage all winter. When you finally turn the water back on in spring, it is stiff, cracked, and does not expand the way it used to. Your erectile tissue works the same way. When months or years go by without regular blood flow, the smooth muscle atrophies, the tissue loses its elasticity, and when you finally do attempt intimacy again, your body struggles to achieve the firmness and duration it used to manage effortlessly. This is not psychological, this is structural, and it starts as early as 3 to 6 months of inactivity. Second, there is a hormonal cascade that most men are completely unaware of. Testosterone and sexual activity exist in a feedback loop. Regular sexual activity, particularly activity that results in orgasm, signals your hypothalamus and pituitary gland to maintain healthy levels of luteinizing hormone, which in turn signals your testicles to keep producing testosterone. When that activity stops, the signal weakens. Your body interprets the absence as a sign that reproductive function is no longer needed and testosterone production begins to decline. Lower testosterone then reduces your libido, which makes you even less likely to engage in sexual activity, which further suppresses your testosterone. It becomes a vicious cycle. And while this decline happens gradually in all men as they age, prolonged sexual inactivity accelerates it significantly. You are not just losing interest because you are older, you are losing interest because your hormonal environment is shifting in response to the absence of stimulus, and that shift is preventable. Third, let us talk about nerve sensitivity and neuroplasticity. The nerves responsible for sexual arousal and pleasure require regular stimulation to maintain their sensitivity and responsiveness. When you go long periods without sexual activity, those neural pathways begin to quiet down. Your brain stops prioritizing sexual stimuli. Your body stops responding as sharply to touch, visual cues, or erotic thoughts. It is the same principle as muscle memory. If you stop practicing a skill, your brain reallocates those neural resources elsewhere. The good news is that neuroplasticity works in both directions. Just as your brain can deprioritize sexual response during inactivity, it can also rebuild and strengthen those pathways when you reintroduce regular stimulation. But the longer the gap, the more deliberate effort it takes to reactivate those circuits. And for men who wait years, the reconnection process can feel frustrating and slow. That frustration often leads to giving up entirely, which is exactly the wrong response. Fourth, there is a psychological and emotional dimension that cannot be ignored. Prolonged absence of intimacy does not just affect your body, it affects your identity. For many men, sexual confidence is tied to their sense of masculinity, vitality, and self-worth. When that part of your life goes dormant, whether by circumstance, loss of a partner, or gradual disinterest, it chips away at how you see yourself. You start to feel older, less capable, less alive, and that internal narrative becomes a self-fulfilling prophecy. You avoid situations that might lead to intimacy because you are afraid of failure or embarrassment. That avoidance reinforces the belief that you are no longer a sexual person, and eventually you accept it as truth. But here's what I need you to understand. That narrative is not based in biology, it is based in fear, and fear is something you can challenge and overcome with action, even if that action feels uncomfortable at first. Now pause for just a second and think about this honestly. If you have gone through a long period without intimacy, did you feel like something in you changed during that time? Drop a yes or no in the comments. I genuinely want to know because this is something men rarely talk about openly, and your honesty helps others feel less alone. Fifth, here is what happens to your prostate health. Regular ejaculation has been shown in multiple studies to support prostate health and reduce the risk of certain prostate conditions. When ejaculation frequency drops significantly or stops altogether, stagnant fluids can accumulate in the prostate gland, potentially contributing to inflammation or discomfort. While this is not an immediate crisis, over months and years, the absence of regular release can contribute to pelvic tension, discomfort during urination, and a general sense of congestion in that area. Your prostate was designed to function with regular activity. When that activity stops, the gland does not operate as efficiently. And while self-pleasure is just as effective as partnered intimacy for maintaining prostate health, many men over 50 stop engaging in that entirely, either because they feel it is unnecessary, inappropriate, or beneath them. That mindset is costing them both comfort and long-term health, and it needs to change. Let me tell you about a patient named Robert. He was 71 when he came to see me, and he had not been sexually active in almost 4 years. His wife had passed away, and he had no interest in dating. He told me, "I just figured that part of my life was over, but lately I have been having trouble sleeping. I feel disconnected from myself, and honestly, I do not feel like a whole person anymore." We talked through everything I just explained to you. I encouraged him to reintroduce self-pleasure as a regular practice, not for recreation but for health maintenance. 3 months later, he came back and said, "I was embarrassed to even try at first, but doc, I sleep better, I feel more like myself, and I did not realize how much I had let go until I started reclaiming it." That is what I want for you. Not necessarily a new relationship or a radical lifestyle change, just the willingness to maintain the parts of yourself that make you feel alive and whole. That is not selfish, that is self-respect. Now I know what you are thinking. You are thinking, "It has been too long, my body has already changed, there is no point trying to reverse it now." And I need you to hear me clearly. That is a lie your fear is telling you. It is never too late to improve your vascular health, reactivate dormant neural pathways, support your hormone levels, or reconnect with your own body. Will you get back to exactly where you were at 30? No. But will you feel better, function better, and reclaim a piece of your identity that you thought was gone? Absolutely. And that piece matters. It is tied to your dignity. It is tied to your sense of agency over your own body and your own life. And the version of you that refuses to give up on that deserves every chance to succeed. Do not let the gap between where you are and where you were convince you that movement is pointless. Movement is everything. Here is your action summary. If you have been inactive for months or years, start with self-pleasure once or twice per week. This is not about performance or pleasure. It is about maintaining blood flow, nerve sensitivity, and hormonal signaling. Support your vascular health with daily walking, a diet rich in nitric oxide precursors like leafy greens and beets, and stress management practices like deep breathing or meditation. Consider supplementing with L-arginine or citrulline to support blood vessel dilation. If you have a partner and the relationship allows it, reintroduce non-performative physical intimacy, touch, massage, closeness without pressure. And if you are struggling with psychological barriers, talk to a therapist who specializes in sexual health. This is a 30-day challenge. Commit to engaging with your body intentionally at least twice per week for the next month. Track how you feel physically and emotionally. And watch what happens when you stop abandoning yourself. If this resonated with you, hit that like button right now. Subscribe if you have not already. And here is what I want from you. Comment below and tell me, how long has it been since you prioritized this part of your health? No judgment, just honesty. I read every comment and I will respond. Aging is not the end of vitality. It is an invitation to live smarter.